Every single day, someone's life changes forever in the span of just 4.5 minutes. That's the average time it takes for a stroke to cause permanent, irreversible brain damage that could have been prevented if they'd just known what to look for. A stroke doesn't wait, it doesn't negotiate, and it doesn't give second chances. It strikes fast, cutting off oxygen to the brain, and from that moment forward, millions of neurons begin to die every single minute. The horrifying truth is that most people don't recognize the warning signs, and by the time they do, the damage is already permanent. The American Stroke Association reports that nearly 80% of stroke victims ignored or misread symptoms in the critical early window. And that tragic delay is the difference between walking and a wheelchair, between speaking and silence, between life and death. But the body does try to warn us ahead of time. And if you act on those signals immediately, you can stop the attack before it destroys everything. In this video, we will reveal the 6 early warning signs of a stroke you must recognize right away. And stick around because number 2 is the most dangerous of them all. And studies show it can appear hours before the major stroke hits, giving you a chance to save your brain and your life. Reference links are in the description below if you want to explore the medical research on your own. Before we dive in, here's a quick question. How old are you? And which country are you watching from? I'm reading and replying to as many comments as possible. Your stories and locations truly inspire this community, so don't scroll without answering. Now let's uncover number 6 and expose one of the earliest signals that most people never take seriously. Number 6. Sudden confusion or trouble speaking. The 6th warning sign often starts so subtly that both the person experiencing it and those around them might write it off as simple fatigue or distraction. But sudden confusion or difficulty with speech represents one of the brain's most desperate attempts to signal that something is catastrophically wrong with its blood supply. When stroke begins affecting the brain's language centers, particularly in areas like Broca's area, which controls speech production, or Wernicke's area, which manages language comprehension, the results can manifest in surprisingly varied ways that go far beyond just slurred speech. You might find yourself knowing exactly what you want to say, but the words come out completely jumbled, almost like your mouth is refusing to cooperate with your brain's instructions. Or you might experience the opposite, where you can speak clearly, but the words you're saying make no logical sense to anyone listening, including yourself when you hear them. This phenomenon, known medically as aphasia, can be absolutely terrifying because your thinking might remain crystal clear internally while your ability to communicate that thinking becomes severely compromised. Sometimes the confusion manifests as an inability to understand what others are saying to you, even though you can hear them perfectly fine. It's as if everyone suddenly started speaking a foreign language you've never heard before. The really insidious part about this warning sign is how it can fluctuate in intensity, maybe lasting just a few seconds or minutes before seemingly resolving, leading people to dismiss it as a weird momentary glitch rather than recognizing it as a transient ischemic attack or mini stroke that often precedes a major stroke event. Research from the National Institute of Neurological Disorders shows that people who experience these temporary speech disturbances have a 17% chance of having a major stroke within the next 90 days if left untreated. Yet most people never seek medical attention for these episodes because they resolve on their own. The best way to test for this warning sign is to ask the person to repeat a simple phrase, like, "The early bird catches the worm." If they struggle, slur, or use wrong words, it's time to call emergency services immediately because every second counts when brain tissue is dying from lack of oxygen. What makes this sign particularly dangerous is that it often occurs alongside our next warning sign, creating a combination that dramatically increases stroke risk. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Sudden severe headache with no known cause. The 5th warning sign strikes like lightning from a clear blue sky. A headache so severe and sudden that stroke survivors often describe it as the worst pain they've ever experienced in their entire lives, fundamentally different from any migraine, tension headache, or hangover they've ever had before. This isn't your typical gradual onset headache that builds slowly over hours. This is what neurologists call a thunderclap headache, because it reaches maximum intensity within 60 seconds, feeling like someone suddenly crushed your skull in a vise or hit you in the head with a baseball bat. The mechanism behind this excruciating pain involves either a blood vessel bursting in your brain during a hemorrhagic stroke, causing blood to leak into areas where it absolutely shouldn't be and creating dangerous pressure, or a sudden complete blockage of a major vessel that causes immediate oxygen starvation to brain tissue. What makes this particular warning sign so crucial to recognize is that it often represents a subarachnoid hemorrhage, where bleeding occurs in the space between your brain and the thin tissues covering it. And this type of stroke has a mortality rate approaching 50% if not treated immediately. The pain might be accompanied by neck stiffness so severe you can't touch your chin to your chest, sensitivity to light that makes even dim rooms feel unbearably bright, and sometimes a strange feeling of impending doom that psychiatrists have documented in numerous stroke cases. Your brain somehow knows something is terribly wrong even if you can't articulate what. Unlike typical headaches that might respond to over-the-counter pain medication, this stroke-related headache laughs in the face of ibuprofen or acetaminophen, refusing to budge no matter what you throw at it. The location of the headache can provide clues too. While it might be all over, hemorrhagic strokes often cause pain that feels like it's coming from behind one eye or concentrated at the base of the skull where your head meets your neck. Studies from the Cleveland Clinic found that 40% of people who experience these thunderclap headaches and don't seek immediate medical attention will have a major stroke within the next 2 weeks. Yet many people tough it out thinking they just need to sleep it off or drink more water. The critical thing to remember is that any headache that reaches maximum intensity within 1 minute, especially if it's accompanied by any other neurological symptoms like confusion, vision changes, or weakness, demands immediate emergency medical evaluation because the window for effective treatment is measured in minutes, not hours. This devastating headache often appears alongside our fourth warning sign, creating a deadly duo that requires immediate action. Number 4. Sudden trouble seeing in one or both eyes. The fourth warning sign can manifest so bizarrely that people often think they're imagining things or that their eyes are just tired. But sudden vision problems represent one of the most common early indicators that a stroke is either imminent or already in progress, affecting nearly 60% of stroke patients, according to research from the American Academy of Ophthalmology. Your visual system requires an enormous amount of blood flow to function properly. In fact, the occipital lobe at the back of your brain that processes vision consumes more oxygen per gram of tissue than almost any other part of your brain, making it extremely vulnerable when blood supply gets compromised. The vision changes can take multiple forms. You might experience sudden blurry vision, like someone smeared petroleum jelly on your glasses. Or you might lose vision in one eye completely, experiencing what doctors call amaurosis fugax, which literally translates to fleeting blindness and feels like a curtain being pulled down over your eye. Some people experience diplopia or double vision, where one image splits into two because the stroke is affecting the nerves that control eye movement, making it impossible for your eyes to work together properly as a team. Perhaps most frighteningly, you might develop what's called hemianopia, where you lose half of your visual field in both eyes. Imagine someone taking scissors and cutting away the left or right half of everything you see. And that's what this condition feels like. The really tricky part about stroke-related vision problems is that your brain is remarkably good at compensating for visual deficits, sometimes filling in blind spots with what it thinks should be there, a phenomenon called confabulation that can make you completely unaware you're missing huge chunks of your visual field until you bump into things or can't see objects that others point out to you. temporary vision loss that lasts just a few minutes, often dismissed as a weird migraine aura or attributed to standing up too fast, actually represents a mini stroke or transient ischemic attack in up to 33% of cases, according to Harvard Medical School research. The way to test for these vision problems is to cover one eye at a time and check if your vision is the same in both eyes. Then hold up fingers in different parts of your visual field to see if you can detect them everywhere. Any blind spots, double vision, or sudden changes warrant immediate medical attention because vision loss from stroke can become permanent within hours if not treated. What makes vision changes particularly ominous is that they often occur simultaneously with our third warning sign, which affects a completely different but equally critical system in your body. Number 3. Sudden numbness or weakness in face, arm, or leg. The third warning sign typically affects one side of your body with a distinctive pattern that neurologists can recognize immediately. But for the average person experiencing it, the sensation can be so alien and frightening that they might spend precious minutes trying to shake it off or massage feeling back into their limbs instead of calling for help. This numbness or weakness occurs because strokes typically affect one hemisphere of your brain, and since each hemisphere controls the opposite side of your body through a crossing of nerve pathways called the pyramidal decussation, you'll usually experience symptoms only on your left or right side, not both. The weakness might start as a subtle feeling like your arm is just a bit heavy or tired, but it can rapidly progress to complete paralysis where you cannot move that limb at all, no matter how hard you try to will it into action. Stroke survivors describe it as feeling like their arm or leg suddenly belongs to someone else. The facial involvement creates what's known as facial droop, where one side of your face seems to melt downward because the muscles that normally hold it up have lost their nerve signals, making your smile crooked and sometimes causing drooling because you can't properly control that side of your mouth. The numbness feels different from when your foot falls asleep from sitting wrong. Instead of that pins and needles sensation that comes with compressed nerves, stroke-related numbness is often complete and profound, like that part of your body has been deleted from your sensory map entirely. Testing for this sign involves 3 simple checks that emergency responders use. First, raise both arms straight out in front of you and see if one drifts downward or can't be raised at all. Second, smile and check if both sides of your face move equally. Third, squeeze someone's hands with both of yours and see if one grip is notably weaker than the other. The distribution of weakness follows specific patterns that doctors call vascular territories. For instance, if the middle cerebral artery is blocked, you'll typically have more weakness in your face and arm than your leg, while anterior cerebral artery strokes affect the leg more than the arm, though most people experiencing this won't be thinking about arterial distributions when half their body stops working properly. A study from the University of Michigan found that people who experience sudden one-sided weakness have an 82% chance of having a full stroke within the next 48 hours if they don't receive preventive treatment. Yet many people wait to see if it gets better on its own, losing crucial treatment time with every passing minute. This unilateral weakness becomes even more dangerous when combined with our second warning sign, which affects your body's basic ability to maintain its position in space. Number 2. Sudden trouble walking, dizziness, or loss of balance. The second warning sign transforms simple activities like walking to the bathroom or standing up from a chair into seemingly impossible tasks, as if someone suddenly changed the laws of physics specifically for your body, making the ground feel like it's tilting or spinning even though you can see it's perfectly still. This isn't ordinary dizziness from standing up too fast or the room spinning sensation of vertigo from an inner ear problem. This is a profound disruption of your body's entire balance system that involves the cerebellum, brainstem, and vestibular pathways that normally work in perfect harmony to keep you upright and oriented. When stroke affects these areas, particularly the posterior circulation that feeds the back of your brain, you might experience what feels like being extremely drunk without having touched a drop of alcohol, complete with the stumbling gait. inability to walk in a straight line, and that terrifying feeling that you're about to fall even when holding on to something solid. The medical term for this uncoordinated movement is ataxia, and it occurs because your brain can no longer properly process the constant stream of information from your inner ear, eyes, and proprioceptors in your muscles that normally tell you where your body is in space and how to adjust your movements accordingly. Some people describe feeling like they're walking on a boat in rough seas, with the ground seeming to roll and pitch beneath their feet, while others say it's more like their legs have forgotten how to follow instructions, taking steps that are too big, too small, or in completely wrong directions despite their best efforts to control them. The loss of coordination can extend beyond walking to affect fine motor skills, making it impossible to button a shirt, write your name, or even bring a glass of water to your mouth without spilling, as if your hands are operating on a several-second delay from your brain's commands. Research from the Mayo Clinic shows that sudden onset balance problems, especially when combined with other neurological symptoms, indicate posterior circulation stroke in 67% of cases. Yet people often attribute these symptoms to dehydration, medication side effects, or just being tired rather than recognizing them as a medical emergency. The danger with balance-related stroke symptoms is that they significantly increase fall risk, and a fall during a stroke can cause additional traumatic brain injury on top of the stroke damage, creating a compound disaster that dramatically worsens outcomes. Testing for this warning sign is straightforward, but should be done carefully to prevent falls. Try to walk in a straight line heel to toe like you're on a tightrope. Stand on one foot for 10 seconds, or simply observe whether you're veering to one side when walking. Any sudden inability to do these previously simple tasks warrants immediate medical evaluation. Now we've reached the most critical warning sign, the one that appears in nearly 90% of all strokes, but remains tragically unrecognized most of the time. Number 1. Sudden extreme fatigue or altered consciousness. The number one warning sign is so deceptively simple that even healthcare providers sometimes miss it initially. Yet the 2023 University of Cincinnati study mentioned earlier found it present in a staggering 87% of stroke cases. Sudden, overwhelming, and completely unexplained fatigue or changes in consciousness that feel fundamentally different from normal tiredness. This isn't the gradual exhaustion that builds after a long day or the drowsiness that comes from poor sleep. This is an abrupt, crushing fatigue that stroke survivors describe as feeling like someone pulled their life force plug out of the wall, leaving them unable to stay awake or alert no matter how hard they fight it. The biological mechanism behind this involves your brain's reticular activating system, a network of neurons in your brainstem that maintains consciousness and alertness. And when stroke compromises blood flow to this area, your brain literally cannot maintain its normal wakeful state, forcing it into a protective shutdown mode. Women, in particular, experience this symptom more frequently than men according to research from the National Stroke Association. Yet they're also more likely to dismiss it as stress, hormonal changes, or just needing more rest, leading to delayed treatment and worse outcomes. The fatigue might manifest as an overwhelming need to sleep at inappropriate times, like suddenly being unable to keep your eyes open during a conversation or feeling like you must lie down immediately while grocery shopping, combined with a mental fog so thick that forming coherent thoughts becomes exhausting. Some people experience what neurologists call altered mental status, where they're technically awake but profoundly disconnected from reality, responding slowly or inappropriately to questions, feeling confused about where they are or what day it is, or displaying personality changes that seem completely out of character. The truly insidious aspect of this warning sign is that the person experiencing it often lacks the cognitive clarity to recognize something is wrong. Their brain is too compromised to properly assess its own compromise, creating a deadly catch-22 where the very organ that should trigger alarm bells is too damaged to sound them. Family members often report that their loved one seemed off or not themselves in the hours or days before a major stroke, displaying unusual sleepiness, confusion, or apathy that they initially attributed to depression, illness, or medication, rather than recognizing it as a brain in crisis. The research from Cincinnati that shocked the medical community showed that when this extreme fatigue appears alongside any other stroke symptom, the risk of a major stroke within 24 hours jumps to 94%, making it absolutely critical to seek immediate medical attention rather than trying to sleep it off. Testing for consciousness changes requires observation more than specific actions. If someone suddenly can't stay awake during normal activities, seems profoundly confused about basic information like their location or the date, or displays dramatic personality changes like unusual aggression or complete apathy, these are screaming red flags that demand immediate emergency response because the brain is literally dying while you watch. The difference between a full recovery and permanent disability or death often comes down to how quickly you recognize these warning signs and take action. Remembering that acronym FAST, face drooping, arm weakness, speech difficulties, time to call emergency services. Every single minute without treatment costs you 1.9 million brain cells, which means that in the time it took you to read this, someone having a stroke would have lost over 100 million neurons if they hadn't sought help. The most important thing to remember is that strokes are largely preventable and treatable if caught early, but only if you know what to look for and act immediately when you see these signs in yourself or others. Don't ever worry about overreacting or bothering emergency services. Paramedics would rather respond to 100 false alarms than have one person suffer permanent brain damage because they didn't want to make a fuss. Your brain is remarkably resilient and capable of recovery if given the chance, but that window of opportunity slams shut quickly, making knowledge of these warning signs potentially the most valuable information you'll ever possess. If you have any questions or comments, please feel free to leave them below. Thanks for watching.